Everyone right to go? There are 80 active cases of coronavirus in Victoria, with just 4 cases overnight. Of today's 4 new cases, we have received initial low positive results in relation to 2 of those cases, and further testing and examination is underway to determine whether they are in fact false positives. We'll have an update around that hopefully later on today, if not in the reconciliation of numbers tomorrow. Until this is confirmed, though, they are, through an abundance of caution, treated as active positive cases. The 2 other cases, that is those that are not believed to be or suspected to be low positives, are under investigation by our public health team, and further work's underway to determine whether they're linked to known outbreaks. There are 5 Victorians in hospital, and none of those are in intensive care. A total of 3,154,371 test results have been received since the beginning of the pandemic. That's an increase of 23,583 since yesterday. And again, as we always do, because it's so important, we thank each and every one of those 23,500 Victorians who got tested just a little more than a day ago. That is a very strong number and critical to us having the most complete picture of where the virus is and to stop it spreading any further. If you get tested quickly, as soon as you have a sense of those symptoms, then we can wrap a public health response around you and your family to keep them safe and keep every family safe, because it stops you unwittingly spreading the virus. The symptoms can be very mild. Even the mildest symptoms should prompt you to go and get tested. There's more than 200 sites. We'll even come to you if you need a test in your judgment and you can't get to a testing site. Nothing is more important, arguably, than people who have got any symptoms at all getting tested, and getting tested really fast. It's how you keep yourself and the people you love the most safe, and it's how we stop this spreading. There are just 5 healthcare workers who are active cases. The rolling average to 29 October is 2.6 in Metro Melbourne, Regional Victoria 0. The unknown cases, or mystery cases, there are now just 2 of those to the 27th of October, and those 2 are in metropolitan Melbourne. In terms of the places where those 4 cases, the local government areas where those 4 cases, so the 2 that are under investigation as to their chain of transmission and potential links to outbreaks, and the 2 that we suspect are low positives or false positives: Wyndham, Brimbank, Hume and Greater Dandenong. There are no active cases in regional Victoria, just to confirm, and we have just 4 active cases in residential aged care, critically important given how vulnerable that industry is. They're probably the numbers of the day that I needed to speak to. I did just want to make a couple of comments in terms of opening up and where we find ourselves. We as a community, and all of us right across the state, have taken some very big steps this week. And it comes off the back of having worked incredibly hard, all of us in different ways, to play our part to drive these numbers down to very low levels. If they're to stay at low levels, though, we all have to play our part. And Brett and his team, Ewan was here yesterday, Jerome earlier in the week, they lead teams of thousands of people, and they are working night and day doing quite extraordinary things. But each and every one of us has got a part to play. We're all in this together, and we'll all pay a price, all of us, one way or another, if we don't play that part. So following the rules, and I know the rules are not fun, but they're there to keep us open. They're there to keep us safe. And if we all play our part in lots of small ways in making good decisions, smart decisions and safe decisions, then we will be able to take another step next weekend, and we'll be able to take further steps after that. And we'll get to Christmas, and it'll be much closer to a normal Christmas than it might have been. Well, indeed, it'll certainly be a much more normal Christmas than it will be if we don't all play our part. So whether it's washing your hands, coughing into the crook of your arm, not going to work if you've got any symptoms at all, instead getting tested as soon as you've got those symptoms, all the way through to a cafe owner making sure that tables are appropriately spaced, making sure that you're keeping a record of everybody who's coming into the shop or the store. All of those things, making sure that if you work at a cafe and you feel ill, you don't go to work. All of these things, they can seem very simple and very small, but they all add up to what we've built. Something that's precious, but something that is fragile. And we all have to play our part to protect it, to safeguard it, and to make sure that we don't have to take any backward steps. This is not I'm not speaking of anything specifically. I'm just ahead of the weekend. I'm just reminding people that whether it's all those examples I've used or literally hundreds more, but particularly at a very personal level, visitors to your home, it's one visiting event per day. And I know that's challenging, but if we want to keep doing that and not be locked down again and unable to see the people that we love, then we've just got to keep vigilant. We've just got to keep doing this. We have to be, as a community, as stubborn as this virus. It's not going away. It spreads rapidly. It spreads silently. We've come so far and done so much that we just have to safeguard that. We just have to safeguard it. What's more, these last few months have to mean something. They have to be worth something. There's a lot of pain and hurt out there. There's grieving. There'll be a big repair job, a big job of work to be done. And the state budget in just a few weeks' time will be the opportunity for us to make those unprecedented investments, not for their own sake, not just to create jobs as if that's a be-all and end-all. It's about creating jobs so that families can have security and safety, and they can plan for the weeks and the months and the years to come, so that the people they love the most can be in as safe and secure an environment and as safe and secure a position as possible. That's what the state budget will be about, and that's what all of us have to be about. Taking these safe steps, playing our part, being vigilant, valuing the fact we've built something that is deeply impressive but fragile, and we all have to play our part in safeguarding that. All of us. There's simply no choice. Just finally, can I just make a couple of brief comments in relation to terrible events in France overnight? We send our best wishes to everybody caught up in that. These are not acts of faith. They're anything but that. It is an act of evil, and it is something that's very confronting, very, very challenging, and we send our best wishes to everybody who's been caught up in this. It's a terrible thing, and all those who are involved are obviously in our thoughts and prayers. Any attack against freedom of speech, freedom of worship, freedom of political thought is an attack on all of us, no matter what country that attack happens in. Any fundamental abuse of faith to commit acts of evil is an attack against all of us and the values that we hold dear. And can I say, the values of community, the values of being in this together, the values of kindness and compassion that have been at play in our great state right throughout 2020. That's what's got us here. And these attacks, albeit a long way away, they're an attack against all decent people all over the world. I now might ask Professor Sutton just to speak to the epidemiology of the day, and then we're happy to take any questions you have.
Thank you, Premier. So, as the Premier announced, 2 of the 4 cases may not end up being confirmed cases. We often think about tests in really black and white ways, that you have a positive or a negative and there's nothing in between. But the reality is, for any test you can think of in the world of pathology, there are always some uncertain ones that sit in between. With any test, PCR test, a serology test, there are some results that are a little bit indeterminate. So for a PCR test, they are looking for gene probes and genetic sequences to ping, and sometimes some ping, but not all of them, that would make it a definitive test. And each and every one of us have differences in our immune response and our immune functioning that can mean some of those tests don't come back with a definitive positive. That said, the PCR test is still, 99.9% accurate. But when you're doing 20,000 plus tests per day, to have one in 10,000 have that somewhat ambiguous result is pretty much par for the course. That'll be happening across Australia, but we're doing so much more testing in Victoria at the moment. So we will have an expert review panel look at those results and hopefully make a call on them definitively as positive or negative. But as the Premier said, we'll treat them as positive. They get isolated and they get worked up as if they're positive until we know otherwise. One of those cases, and they'll be interviewed this morning, a lot of these results came through very late last night, has been in and around the Deer Park area. And so until we know more about the potential exposure sites, potential movements of this individual and other close contacts that we can identify, I would encourage again anyone who's symptomatic, especially in the Deer Park area, to look for a testing station nearby. I know there's one at IPC Health in Deer Park, that's at 106 Station Street. Its normal operating hours are 9 to 4:30. It may well get very large queues today, so please don't only go to a single site. Look around. If there are very long wait times, if there are very long queues, we will try and stand up other testing stations that pop up in the vicinity today. But until that's all been worked through with the incident management and outbreak management teams, look around for those normal testing sites around Deer Park, but not just the one that I've mentioned, because I expect that there'll be quite a few people who might go there. On the issue of testing, fantastic to see the testing numbers. And you know, whether you end up being a weak positive and not classified as a confirmed case, or whether you're a confirmed case, the people who are testing are the absolute heroes in Melbourne at the moment. They are the individuals who mean that we can identify any last remnants of virus that might be circulating in Melbourne, and that we can end it. So my enormous thanks to those individuals. That's it from me.
Sorry, just before you go, on Twitter this morning you mentioned that another case might also be historical or recovering.
Yeah, again, needs to be worked through. There's some reconciliation for that case. We'll need an interview, but the suspicion is might have gone through an illness and be testing way at the end of that illness when no longer infectious. But I wouldn't jump to that conclusion. It needs to be worked through. But
it's one of those cases that's under investigation, not one of the weak positives.
No, it's one of those that are under investigation, so it needs to be worked through, but may not be of concern in terms of being an active case.
Brett, is there anything further on the child that Ewan was talking about yesterday out of Bundoora, or do you think any further investigations and updates out of that?
Not that I'm aware of, Simon.
Any other cases that are connected to that northern suburbs outbreak?
No. And again on the testing front, fantastic response. There'll still be just a few to come through of the primary and secondary close contacts, but there's been such a great response there.
Is that outbreak?
Of the 23,000 tests we've done, how many of those are part of the high-risk workplace asymptomatic tests?
Oh, I'm not sure the exact numbers. We can bring you that breakdown, but there's a good few thousand that are done routinely on a daily basis for that workplace surveillance testing. Obviously, as we've flagged, about 25% of those high industry workforces will get tested on a weekly basis, so they'll get through 100% of those in a month. But I'm not sure of the 20,000 plus have come from that today.
I didn't know if they were skewing the tests, because we've seen really big testing numbers.
Yeah, I don't think so. They're not. It's not like it's 10,000 test results. It's a few thousand. It might be, it might be 2,000 or 3,000 on a daily basis. But we've got that capacity. We can get those test results back, and it can pick up some of those. We obviously want to protect those industries in particular, and it's an opportunity to find people who might be asymptomatic or have very mild symptoms who wouldn't otherwise get tested.
Brett, what's your message to industries, cafes, pubs as they open up, particularly around following the rules, and obviously the government yesterday and today is doing a big push on enforcement. So what's your message on that, given that they're your directions?
Yeah, the message is absolutely enjoy the phase that we're going through. People have a right to feel and should feel, and I love seeing the expressions of a positive and forward-thinking population in Victoria. That's great. It is not over. It will not be over until there's a vaccine that goes in that first shoulder and can be distributed across Australia. So we do have to recognise that if we put aside all of those behaviours that we know have worked in stopping transmission, then we put everyone at risk again. So for industry, for people who are attending any of these settings, bear in mind that this can take off again if there's a single case out there that's not identified. So keep your distance, hand hygiene, record where you're going, and for industries, make sure you're recording people's details and that you're following your COVID safe plans. And if you're high risk, all of the requirements of that COVID safe plan, which are not insubstantial but are critically important. People will feel more and more relaxed as time goes by. I know, on the other hand, some people are very anxious about going out and they're very anxious. They get the daily numbers anxiety, a little bit like I do. But in between that, it's just about doing those standard things, making sure that if you're unwell, you're cancelling that night out. You are not visiting family, you are not seeing friends indoors or outdoors. And if you see individuals who've got a cough or a runny nose, politely but firmly decline them attending your house or seeing them, because they could be putting you at risk. So they're really important things. We will be watching these industries. We need to, because if people are cramming inside in an indoor area, not following the density quotient, not following the distancing and hygiene measures that we know are really important in reducing risk, then they're putting everyone's health at risk, and it's only right that we should pull them up on it.
So it's
Professor
really a
Sutton, as we
collective, it's
become-
really, just to follow up, there's really a collective responsibility.
Oh,
in this respect,
absolutely.
Because, like you were just saying then, if you've got someone coming to your house with a runny nose and you want to turn them away, I mean, that's a bit tough. That's a tough spot to be in, isn't it? Because you don't necessarily want to be the police or dob someone in, but
No, and it's not about being mean. It's about following the advice that I'm giving, that others are giving about what we need to do collectively. So on your side, if you've got a kid who's unfortunately got a cold at the moment, they shouldn't be going out. If you've developed a new cough, a new sore throat, a new fever, you shouldn't be going out. But everyone needs to play their part. I know people have flagged issues of ventilation. I think that applies in households as well. I might make a video on it to give a little bit more detail, because that's a really important measure. So opening windows and doors, weather permitting, if you're having another household visit your house within that 25k, that's an important risk mitigation as well.
Professor Sutton, as we begin to open up and people become more complacent, move around, just how great is the threat of a third wave?
Look, I think it's minimal, but I don't want to say it's zero, because it will not be zero for any of us in Australia until there is a widespread use of a vaccine that's effective. So we do have to just have that awareness ongoing. The mask wearing is part of that. I was privileged enough to see Dr. Anthony Fauci on his call with University of Melbourne. He was absolutely praising Melbourne's attitude towards face masks, and he wished that it could apply more broadly in the US. He said it's become politicised. It's become a bit of a mark of where you sit, and he just thinks it's good public health practice, and it's fantastic that Melbourne's taken that on so strongly.
With regards to the QR code check-in app that's due to be done in a few weeks, I believe New South Wales is aiming for around 3 million downloads. How many downloads would you like to see in Victoria?
Oh, look, as many as we can possibly get. I'm not.
Target, though?
Sorry?
Is there a target though?
Not for me personally, but DJPR are focused on the rollout, and I'm sure they'll have their own targets in terms of what's feasible and practicable over the next few weeks. But of course, I'd like it to be maximised to the fullest extent.
We've seen a lot of people. Sorry, I've just got one more. We've seen a lot of people who've been going to restaurants and cafes, and not everyone has been asked to hand down their details as they should be. Should there be a marshal at these places to ensure that it is done?
Oh, I think the managers in these places are effectively the marshals. They need to make sure that those details are captured, and because they're ultimately responsible for that. But as individuals visiting as well, you should play your role and ask for it. If you haven't seen a place where you can record your details, then request that you should.
Brett, personally, how do you feel seeing images of people who do appear to be back to back at cafes and all of that, and not following social distancing restrictions in venues. How do you feel personally seeing pictures like that?
Look, I'm mostly happy that we're going towards a more normal way of life. It's been such a tough journey. But yeah, there's an element that makes all of us, I think, anxious when we see images where the risk of transmission can occur in those settings. And again, collective responsibility. We'll do what we can from an enforcement and oversight point of view between WorkSafe and authorised officers and others. But as individuals, you can make those choices as well. If you're being asked to cram in with others, please decline. Go to a safe place where you can enjoy your food or drink or whatever else safely. That's your entitlement.
We heard from a delivery driver today, Brett, that he went to 15 locations in the CBD and the western suburbs, and only one took his details down. Do you think maybe there is too much responsibility on the managers and people who are involved there to take those details? That's only 1 out of 15, and he's there for quite an extended period of time. He was concerned. He's now taking his own details and keeping a record and database himself. But what's your reaction to that?
Yeah, look, there is a not insignificant administrative burden to do there, but we all have to step up to it. And again, if somebody else isn't holding up their side of the bargain, but you're motivated to do so and you can, absolutely record it. We're asking people to record who's visiting their house on a daily basis. That's something that each and every individual can do. So we'll continue to push for that oversight to occur and for those businesses to do the right thing. But to the extent that they're not, all of us as people accessing those services or going into those settings should play our part as well.
The approach that we've had throughout this second lockdown, we've had fines that have been increased up to $5,000 for breaking rules and things like that. What gives you confidence now that we can trust individuals to do the right thing when before we were threatening to give them a big fine as the way to stop them doing the wrong thing?
Oh, there were really high stakes for some of those things going into regional Victoria when you didn't need to. They were appropriate fines in terms of their size because the stakes were enormous. The stakes remain enormous. Many of those fines are absolutely still in place and would be, will be pursued by VicPol, I'm sure, if they're breached in ways that really do put people at risk. But we're talking about opening up for each and every individual. All of us will have an opportunity to follow or not follow the rules and make the right choices. So it's not a matter of being able to police each and every one of those interactions, each and every one of those choices. We just need to emphasise that this is not over. It will not be over in the long term until we've got a vaccine, and that we just need to be mindful of our individual and collective responsibility here, calling others out again politely, but appropriately. And doing the right thing as individuals.
And the New South Wales Premier says that before opening the border, she wants to see at least 2 weeks that numbers stay down. From your perspective, are you looking at that 2-week limit as well to see how we manage opening up? Will you kind of sleep a bit easier if in 2 weeks our case numbers are still low?
Yeah, absolutely. We don't want to see another outbreak that tips those numbers up, but we've had 2 weeks of low numbers. We're averaging just over 2 in the last 2 weeks. So we've already had that 2 weeks. If another 2 weeks provides those same numbers, that's absolutely reassuring. And if we have more days of zero, even better.
Brett, you said earlier if we can find the last remnants of this virus in Melbourne and end it. Do you mean like those particular cases, or can we push for elimination at all, even coming out of lockdown?
Well, elimination may happen by virtue of finding everything that's out there. We're not hanging our hats on that because there could be hidden cases, there could be chains of transmission that just go on without being detected. But no one will say no to stopping those chains of transmission if they're out there. So if we can find each and every case that identifies those chains of transmission and use the isolation and quarantine and that really broad contact tracing that's being done to stop all of it, fantastic.
So you do believe that that's possible, obviously?
Yeah, it's absolutely possible. It's happened everywhere. There's a grumbling number of cases in New South Wales, but it's within our grasp, and if it's a byproduct of everything that we're doing routinely for each and every case, then fantastic.
How much is hay fever adding to our testing numbers?
Look, who knows? 1 in 6 people suffer from hay fever. How many of those say, oh, this is just my absolutely classic hay fever? It's mostly sneezing. It goes away after a couple of hours if I've been exposed outdoors and not get tested. It is hard to say. But I would say if anyone's got anything that's over and above their normal hay fever or different from their normal hay fever, or it's not settling in a way that it would normally with their usual medication, they're the same symptoms that are present with coronavirus, a runny nose in particular. So get tested to be sure, get that negative result within the day, and carry on as normal. And you can provide that reassurance to people you're visiting. If you're sneezing and they're wondering, you say, I've got my negative test, all good.
Just one more.
Yeah, go for it.
How do you see the international situation playing out, especially in Europe at the moment? It's looking pretty dire.
It's very dire. They are coming down to hard choices of lockdown, and the same impossible choices we faced a couple of months ago. There are systems that are getting overwhelmed there in the health services, with 70+% of ICU beds with COVID patients. Belgium, I heard, having doctors continue with a positive result. Really dire choices. We've avoided that. That's a fantastic result for Melbourne, but I do worry about all of the resurgence across many countries in Europe, and some hit particularly hard. France and Spain, Belgium, the Netherlands in particular, Czech Republic.
Testing numbers, Brett, they're up to about triple some days what we had when we opened up the first time. I think we were down to 7s and 8s after the first wave. Why do you think it's so much bigger now? How much of it is the government kind of having more sites and approaching it better, and how much do you think is it individuals being more aware of it?
I think it's a bit of everything, and I think it's great that it's a bit of everything. People do have that awareness. They're not complacent that they don't need to test when they've got symptoms. We know that people should test when they've got symptoms. We're still getting positive cases, so it's really critical. So I think people understand that and are stepping up for testing and realise that they can get that result really quickly. So that's fantastic. But also, 200 plus testing sites in Metro Melbourne in particular. You don't have to go much more than 5 or 10 k's for a test site, and to have pop-up sites go to where people are being prompted to test, and to have drive-through testing, it's really convenient. So I think that's playing its part as well, and it's all good news.
Do you think we were complacent the first time?
Yeah, I think in many ways we were complacent. I think everyone who's been in Victoria thinks back and realises how differently they're thinking about where we're at now, and how how awful it is to have gone through a second wave, and how critical it is not to be in that situation again. If that's a reminder for all of us, then that's terrific.
Premier. Gyms, that industry says it has some new data that shows the risk of infection is less than 1 in a million, and they're happy to tell their members to wear masks. Is there any way of them getting their density limits increased or anything like that? We will always look through as this evolves, and if there's another couple of weeks of very low to no cases, then that, like all other industries that still haven't opened, will be under consideration. It is fair to say that even gyms that did regular testing of staff, that did symptom checks and fever checks for people who were coming in who had density quotients or spacing between people, with the indoors and the exertion, there have still been outbreaks. So we do have to keep that in mind, but again, the lower the numbers, the lower the risk that anyone will be turning up to a gym as a case.
Premier,
one more, sorry. On this the Bunduru case, are we using the approach of isolating contacts of contacts there too? Is that every single outbreak we're doing that now?
Yes.
And that was about 100 people, is that right?
I'm not sure the exact numbers.
Really?
Yeah. There we go.
Premier. Thanks, Brett.
I think about 90, Michael.
Premier, just as we speak now, the Royal Commission into the Bushfire disaster over the summer is being released. It has 78 recommendations, and one of them is to allow the federal government powers to declare a state of emergency in a state, for taking that power away from the state. Now, obviously, we're in a state of emergency for COVID, and that would maybe be required for bushfires. What would be your response to that?
As you point out, I've not had an opportunity to read the Royal Commission's report, but I'll make a broader point than that. It is always best when governments work together and be focused on the challenges at hand, and nothing else should be a consideration in any way. But let's have a look at the report, the different recommendations they make, and then no doubt this will be a discussion that we'll have at National Cabinet and in other forums.
Survivors have pushed for an expansion of the water bombing fleet. Is that something we could look at?
Well, every summer we make sure that we have the very best equipment, the very best machinery, the very best of tech anywhere in the world, as well as the quantities of those machines that we need. So whether it's fixed wing, rotary, with the forward-looking ultraviolet cameras, the notion of being able to, infrared I should say, being able to do water bombing at night, for instance. That's been a feature of firefighting in Victoria the last season, or certainly last season. I'm not sure whether we might have done a bit of trialling of that the season before. We're always looking to have more, but also better kit, if you like, so that our career firefighters, our volunteer firefighters have got everything that they possibly need. And I think there's a great opportunity out of this tragedy and out of the Royal Commission process to be a much more, if you like, supply secure firefighting effort. I think there's some products that we shouldn't be importing, we should be making them right here, and I think Victoria is very well placed to be able to do that. The notion that fire seasons are getting longer and more dangerous on both sides of the world, so the notion of us having to, in recent years we've done some things we've never done before. We've had to compete with the Northern Hemisphere for some of the machinery and equipment because we've had fires at almost the same time. Their fire season running late, our fire season having come very, very early. So the more we can do and be as self-sufficient as possible, and I think that there are some settings in Victoria that lend themselves just naturally to that, whether it be manufacturing, basing, whether it's choppers, fixed-wing bombers, we are absolutely ready to play our part in that. But I don't think it's unreasonable that I have an opportunity to have a read of the report.
On enforcement of COVID rules,
yes.
Can you just update us on who's out there going door to door with businesses?
So there's a range of authorised officers, others from the Department of Jobs that are working very, very closely with individual businesses. That's normally on a sector by sector basis because there are different risks, different challenges, and indeed there's different rules. WorkSafe does play a part, much more less public facing, more about inside the actual workplace from a occupational health and safety point of view, but good OH&S means good public health given how rapidly this thing spreads and the fact that workers go home to families and families then go to work, and we're all very familiar with that kind of pinballing between high-risk workplaces and large households. And then of course Victoria Police are out there from a public order point of view. These rules are important, and if you're enjoying the fact that you can have a coffee that you didn't have to make at a cafe, or if you're enjoying the fact that you can go and have a glass of wine or a beer, and if you're a business that's pleased to be open, then all of us have to play our part in staying open. All of us have to play our part in taking down names and details, in keeping people spaced, in making sure that as staff members we don't go to work sick. As the boss, we don't have anybody working a shift that is unwell. All of those rules are about keeping us open. They're not about closing the place down. They're about keeping us open and keeping us safe. And we just have to keep going. We can't now, after all that we've done, we can't now let our frustration get the better of us and get to this place where we say, well, look, I desperately want it to be over, so I'll pretend like it is. The vaccine is not here, and that we don't know when that vaccine will come, and we still don't know what the nature of that vaccine will be, whether it protects some people and not others, whether it protects people for a short period of time or a longer period of time. You know, all of this is still up in the air. We've got to control the things we can, and that is our own choices, our own behaviour, and the seriousness with which we take this deadly virus. If we all keep doing as we've done, then we will keep these numbers low.
If a vaccine doesn't come, do we live with some sort of restriction for indefinitely?
Well, we'd certainly hope not. the point I'm not casting doubt on whether a vaccine will ultimately arrive or not. I think there's a pretty broad consensus that they'll get there, whether it's a therapeutic or vaccine. But the nature of it, how it'll work and who it works on and for how long, plus of course timelines around you've got to make it, then you've got to actually get it out throughout the Victorian community. All of that takes time. It's not coming next week. Despite some commentary about it being here very soon, it's not coming next week. It is some way off. And having built a set of numbers that are being internationally recognised, and that's not to in any way diminish the pain and the grief and the healing that will be necessary this year and next year, but people should be proud across Victoria of what they've built. But the thing with precious stuff is you need to value it, you need to cherish it, you need to make sure that you're playing a part, every single Victorian's playing a part in keeping these numbers low. And it does get down to really simple choices. And, you don't have to be a mathematician to work out. Millions of Victorians making dozens or even hundreds of choices a day. There's lots of points at which this can go wrong. And that's why it's on the government, but it's on every family and every individual and every business owner. It's on everyone to keep these numbers low.
Just on COVID cleaning.
Yes.
Premier, are you concerned by what's been uncovered by IBAC, that a cleaning company engaged by V-Line and Metro to undertake deep cleans in trains may have been compromised and been allegedly bribing the chief executive of V-Line, who has since been stood down and sacked?
Yes, I am concerned about that. They are serious matters. And I've sought reassurances that we have got only the highest standard of not just contracts, but we have actual cleaning going on. Victorian taxpayers have, and public transport users, should expect nothing less. And I've been given those assurances. As to what's gone on here, that is, as you know, being actively dealt with by IBAC, and I'd have absolute confidence that IBAC will get to the bottom of that, and we'll see where that goes. The board has taken some steps against two people, which is not exactly this issue, but it's linked to it, and that is, I think, the appropriate thing to have done.
And why did it take so long to remove this person from their commission? But I'm talking about the V-Line CEO specifically. Is there a problem that this hasn't come to light earlier?
Well, look, you would prefer this sort of conduct, which is alleged at this point. There's no findings yet, but this sort of conduct, as alleged, you'd always prefer that it didn't happen. But that's why you have integrity bodies to go and find and make sure that if there are issues, they get dealt with, and we should let them continue their work. They're certainly getting on with it, and they're doing a very good job. So we'll wait and see where that lands. Ultimately, the fact that we are having a discussion about this means that it has come to light. There's processes to be run, and we should let them work their way through.
We opened up on Wednesday. People will probably be out and about this weekend.
They will.
Are you worried that next week there may be an uptick in cases, or is next week kind of the test to see how things are really going after that
Michael,
weekend?
I think every day is a test. Like, it was a very late night last night because we were... the board had none on it at about 11, and then not long after these four cases popped in. And look, two of these may well be false positives. The others may well be people that are in quarantine, or they're basically ISO at home, so they're close contacts known to be linked to other outbreaks, or they may not be. Even at 4, that is a relatively low number, but every day is important, and every day the numbers are very carefully watched and considered by everybody involved. So I think it's not going to be a point where I'm particularly concerned for a period of time and then suddenly I'm not. I think we're going to have to be, the nature of being vigilant is that every case, every day, will be critically important until we have the ultimate thing for this, and that's of course that vaccine whenever it might turn up.
But the first weekend after we've opened
Oh yeah,
up,
look. So as I said off the top,
weekend probably too. It's special status, is it?
As I said off the top, the rules are there to keep you safe and keep us open. So if you, in your individual choices, and many of those are made behind closed doors, if you make bad choices, then you put at risk everything that you've built and everything that every Victorian family has built. That's not smart, and it's also not fair. So I just appeal to people: enjoy the hard-won freedoms within the rules this weekend, don't put them at risk by letting a sense of frustration or a sense of complacency convince you that it's over because you want it to be. I want it to be over too. But it will best be over if we just stay the course. And that's exactly how we got to this point. I don't know how many times I've made the point again and again and again, because it was the important point to make, that if we just followed the strategy, we would get to less than 5 mystery cases. We would get to less than 5 cases per day on a 14-day rolling average. And on Wednesday, when we were able to take that step to open up, we had met both those targets. Similarly, we'll keep the numbers low if all of us play our part in doing that. And that means no one gets a leave pass. 25 people to your house, oh, it's all fine, don't worry. Well, no, that's not appropriate. Any business not doing as they should do, that's not appropriate. We've all got to acknowledge that what each of us do matters not just for us, but for everybody. We are literally, I know this sounds like political speak or, cliches, we literally are all in this together. And if we all play our part, we'll all benefit from that. And just as we are now, we've all stayed the course. We've all found it in ourselves to have the character and the courage and the compassion to look out for each other and to see this strategy win out. But it's not over. It's not over. And this thing is stubborn. It lurks. It will be there in the shadows for a significant period of time. And even if it's not, to the earlier point, even if it's not, we'll have to assume that it is, because we can't test everybody every single day, and the vaccine isn't here yet. So the weekend, it's not a matter of being concerned more or less. I'm concerned every day to see every Victorian make smart choices, because they benefit from those smart choices.
Are you confident we can take the next steps on November 8th still? And do you have...
Yeah, I am.
Do you have thresholds for where we need to be for that to happen?
We want to continue to see numbers low. We want to see this trend continue. And
are there specific numbers we must meet?
Look, I think that if we continue to perform the way we are now, over the next week or so, then we'll be able to take that step on the weekend. But I just say to people, no victory over this is easy. Like it's all hard fought. And if what people are enjoying now matters to them, and I know it does, it absolutely does, then why wouldn't you play your part to safeguard it? Why would anyone make bad choices to fritter away everything that they've helped to build and that we've all built together? I don't want to be overly negative about it, but I just think this weekend will be important. Every weekend, sadly, till a vaccine gets here, will be important. But let's all just play our part, do the right thing, and then we can continue to enjoy all those freedoms that we've been craving, all those things that are so important for livelihoods, for that sense of security and certainty, and all those things that that are much closer to normal than we've been pretty much for the whole year.
People in Melbourne, Premier, can now go to Singapore but not to Phillip Island after the Singapore government widened its travel bubble to include travellers from Victoria. What's your response to that?
Well, my response is that you'll be able to travel to other parts of Victoria when it's safe, and it isn't safe to do that now. And in my many conversations with people from regional Victoria, some from very small communities, some from much larger regional cities, they are keen to be reunited with Melbourne and to have a common set of rules, but they're also keen to make sure that if the rules are the same and the movement is free, that the risk is about the same between Melbourne and regional Victoria. And we're not at that point yet, but we will be at that point soon.
What do you think of the travel bubble though out of Singapore? The fact
travel bubbles are an important part of, I think, that COVID normal, and whether it be with New Zealand or with Pacific Island nations or with Singapore or whomever it might be, I think they will be a feature of 2021. But again, that'll have to be done very carefully, and I'd have confidence that the Commonwealth Government will take very cautious steps around that, and National Cabinet will continue to talk about it.
Premier, Anastasia Palaszczuk is keeping the border shut to Victoria but is opening up to the rest of New South Wales come November 3. Were you hopeful that regional Victoria would have gotten a look in?
Oh, I don't think so. I think that it's perfectly reasonable. I had some text exchange with Gladys this morning. They're very keen to wait the couple of weeks and they want to see how things unfold once Victoria is whole again. So it's not unreasonable for them to wait and see. I don't think that no Premier takes any joy from closing borders. But ultimately, those individuals, whether it's Anna or Gladys or Mark or Peter or anyone else, they've got a responsibility to do whatever they can to keep their community safe. And I've never been critical of that, as hard as it is for people who live on those border communities and others who, for various reasons, need to travel. But the biggest and best and most important thing we can do as Victorians is to play our part, do our bit, each of us, to keep the numbers low, and then the borders will be open, and we'll be able to travel freely within our state, and we'll be able to travel to other states and potentially to other parts of the world. I've got no criticism of those who've made those choices, and I'm confident that there'll be a logical, sequential, evidence-based and data-driven and epidemiologically driven approach to opening up those borders. But we've always said, thousands of times I would think, that the cycle of this virus is not a day-by-day thing. It's 10 to 14 days, and it's not unreasonable to wait and see how things evolve, how things unfold. I'm sure, though, that other premiers, and indeed some in the Commonwealth too, I would think, would be very pleased not just to see low numbers in Victoria, but very, very high testing numbers that are still only delivering very, very small case numbers. They are the highest test numbers in the nation by a factor, and we aim to keep them there.
Community clubs,
Questions, please.
are saying the picture isn't so rosy for them. 75% can't offer outdoor dining. And according to Community Clubs Victoria, 200 of the 1,000 they represent are on the verge of collapse. Does the roadmap help them enough, or is there more we can do for community clubs?
I'm more than happy to have a conversation with Leon Wiegard and others who I think represent that sector, if my memory serves correctly. There's some perhaps some things we can do. We're more than happy to sit down and try and work through those things. The thing is this. I'm not being critical of anybody who can't use the outside space, but we did have, just think back a few weeks ago, and there was a chorus almost, and we were told, oh no, there'll be no outdoor drinking and dining, we can't possibly do that, we've got to have 150 people inside and all these sorts of things. And now look at it now. And this won't just be a COVID summer drinking and dining outside or having a coffee, whatever you want to do. It'll finish up being a feature, I think, of the summer period each and every year. And we will make much better use of space that has been to a certain extent wasted, or at least not utilised to its highest value. A few car parks gone, tables and chairs in, looking at some public space too, parks and things of that nature, some laneways that have literally no traffic, but can provide not something that's that different. It's just an expansion of our unique food, wine and coffee culture. That's all about jobs. So we're always happy to work through things. And if there's a need for us to engage with community clubs more, we absolutely will.
Premier, on borders, the New South Wales Premier said yesterday that our lack of an overarching QR code system was an example of their ongoing concerns about contact tracing in Victoria, and that could potentially push the border being opened back. What do you make of that?
No, I wouldn't infer that at all. I won't go through the text messages I've had with her this morning, but she, I think, was prompted to send me a text message because she was perhaps a little concerned that I might get the wrong impression about our partnership by looking at some of the news reporting of what she'd said yesterday. We are working very closely together, and all she wants, and she's confirmed this for me again this morning, Premier Berejiklian's only ask is that she gets given a bit of time to wait and see how things unfold. And I don't think that's an unreasonable thing. That's not an unreasonable thing at all. On QR codes we'll get there, but it's got to be done right. It's a little bit more complex than people think. People have to have confidence that it's going to work, and confidence that it's only there for the purposes of public health. We'll make some further announcements about that soon. And I would just note, and this is again in no way a criticism, it's just a fact, New South Wales have only moved to the kind of final instalment of their QR product. In fact, they're in the process of doing it now. We will get there, I expect, at the same point in that opening up journey. We will absolutely have the product out there and working very, very well.
So do you think the earliest it would be then is 2 weeks after the 8th when Victoria becomes whole again?
The earliest for what?
For Gladys was saying that it'd be she wants.
Yeah, I think that it would be unwise for us to assume that the border into New South Wales would be open until at least 2 weeks has passed, since everybody in Victoria can move freely. That would be my reading of it. It's not for me to announce what the New South Wales government position is, but I think that is a realistic expectation that all of us can have. I would just again say though, I'm going to be encouraging people not so much to be travelling to Sydney or other places. I'm going to be encouraging people to stay local and to spend as much time and as much money as they can supporting their fellow Victorians, and I'm pretty confident people will do that. There are some trips that are obviously important, and hopefully we can have those as hassle-free as possible, certainly by the end of the year. That's the National Cabinet approach, that's the National Cabinet decision, and everybody signed up to that.
Premier, just on that, obviously we're walking on eggshells at the moment. There's a threat of going back, more restrictions, etc. How can people have confidence to make any Christmas plans at all, considering that? And then also, what's your reaction to the opposition's idea of half-price holidays in regional Victoria?
Yeah, look, there'll be some very significant announcements of support for the tourism sector, particularly in regional Victoria. We'll make those at the appropriate time. They'll be a feature of the budget, if not before then. Other states have done similar things, and we think it's worked well. We've provided very significant support to regional tourism businesses, particularly those who had to cancel bookings, and that not only supports them as employers, but it also supports people who had made bookings. We want these providers to be there and be viable to be open up again, and they are open now, obviously for people within regional Victoria, and hopefully very soon we'll be able to have a situation where, basically next Sunday, so not this Sunday but the Sunday after, Ring of Steel comes down, 25 k's goes, people have got that freedom of movement. That's really important for that sector. And now I'm sorry, I've forgotten the first part of your question.
Confidence going into Christmas.
Christmas, look, all of us, if we make those choices I've been talking about, those personal choices, and I fully accept no one's perfect, right? There'll be people slip up, it can be tiresome, it can be frustrating. Everyone wants it to be over, absolutely. But when that's not the reality you confront, you can't pretend. We all just have to keep making good choices. And there's a very significant reward for that. There is that ability to go and have a coffee, the ability for your friends and family, or even you yourself, to have your job back, to be back working again, the ability to begin to repair the damage that this pandemic has done to us. That's only possible once you deal with the health issue. So I think people can be confident, but we have to be vigilant. Confident, but we just can't allow ourselves to pretend it's over because we desperately want it to be. That's not on the table. I'm doing everything I can. We are all working night and day to have a COVID normal Christmas, but we can't do it on our own. Victorians have to help us build that and safeguard what we've already built, which is an internationally significant set of numbers with a lot of pain and a lot of hurt. That's worth something. It's so valuable, and we all just have to invest in it by the individual choices we make.
Are you expecting to make that announcement about the next step on next Sunday or before that day?
I'm not sure yet. I think it's a fair bet to say it'll be on Sunday, because we always try and wait to get as much data as we possibly can and to make sure that the trend is as if you like, contemporary as it possibly can be. But they are very significant steps in a number of different sectors, and they're significant steps very much at a personal level, the ability of people to be able to travel further, and indeed the ability of people to move much more freely between regional Victoria and metropolitan Melbourne. I know that'll be very important for a lot of people at a very personal level.
On the Bundoora one quickly, those 90 or so contacts that are isolating,
yes.
Are they all getting tested, and when might we get the results for those?
Let me come back to you. I'll get you an update. I haven't got an update on that this morning, but we had a number of children who had been at the childcare centre. I think that was about a dozen. We'll have all their results back now, because we had 8 of the 12 yesterday. There were 4 staff members, and I think we had 3 of the 4 staff members test back yesterday when we stood up, so we'll have that last one by now for sure. And then the rest of them are household contacts. And people will be released from the restrictions that have been imposed on them at various points, depending on whether the person that connects them to the case tests positive or negative. Other close contacts have to wait for the day 11 test, regardless of what other people test. But it is an approach that's working very well. We're very grateful to the many hundreds of people over these last few weeks, probably thousands when you add them all up, who, as a result of various outbreaks, have, through a really precautionary policy, They've stayed away from other people. They've stayed at home. It only works when people do that, and I'm deeply grateful to them. If there's more we can put in the show release later today, we will. Any other issues? If not, I will not see you tomorrow. The Minister for Health will conduct the daily briefing, and I'm sure you're all very pleased to hear that
Buried the
news.
lead there from you.
Thank you very much.